Hello, everyone. My name is Jessica Porras, and I'm the Senior Manager for Education and Outreach at CAQH CORE. Welcome to our May Town Hall webinar. Next slide. I'd like to mention a few logistical items. A copy of the slides and the webinar recording will be emailed to you in the next day or so. Also, we will have time at the end of today's program to respond to your questions. I encourage you to submit your questions at any time during the webinar by typing them into the questions panel on your dashboard. Next slide. We have a lot to cover during this town hall. We will start off with an overview of CAQH CORE and federal activities, and then walk through our initiatives on prior authorization, attachments, value-based payments, and core certification. Next slide. So let's get started. I would like to introduce our first speaker, CAQH CORE Director, Erin Weber. Erin?
Thanks, Jessica, and thanks everyone for joining us today. I hope the weather has taken a turn in your part of the country as well. We're finally seeing sun out here on the East Coast again. I'm going to very quickly go through a quick overview of CORE for those that are not as familiar with the initiative, and then highlight a couple things that are going on at the federal level that are relevant to our work. Next slide, please. So CAQH CORE is a nonprofit collaboration of stakeholders, including health plans, providers, vendors, clearinghouses, government agencies, associations, and others that work in the administrative side of healthcare. Our mission is to drive the creation and adoption of healthcare operating rules, which really serve as the business rules to support the standards. They describe kind of how to use the standards and what information goes into the standards in some cases. We were designated by the Secretary of Health and Human Services as the national author for operating rules under Section 1104 of the Affordable Care Act, and we're governed by a multi-stakeholder board. The image on this slide is our integrated model. One of the things I want to highlight is we see our role not only as the operating rule authoring entity. We do convene the industry, develop rules through testing and piloting and work groups, but we also are really committed to driving adoption across the industry, measuring the impact of the rules through our certification program and the CAQH Index. We also do quite a bit of education and outreach, such as these webinars today. Next slide. To date, CORE has developed 5 phases of operating rules. More on our latest phase of prior authorization operating rules later in the presentation. But these rules really do impact the entire revenue cycle in healthcare, from the eligibility to the payment itself. We are working on a new phase of rules related to attachments, just getting started in some of that work. We'll share a little bit more about that today. But the use of electronic transactions in healthcare really saves a lot of time and resources for both providers and health plans, as you can see from some of our CAQH Index data. Just transitioning from phone or email or fax to the HIPAA administrative transactions can save organizations a lot of money on a per transaction basis and an industry-wide basis. Next slide. So a couple items I want to highlight that have occurred since our last town hall. Earlier this year, CMS announced that they were launching a compliance review program. This is coming out of the National Standards Group at CMS, and this program is designed to ensure organizations, in particular health plans and clearinghouses, those HIPAA-covered entities, are operating in compliance with the HIPAA administrative simplification requirements. And those include requirements for electronic transactions, code sets, unique identifiers, and operating rules. In their announcements, they noted that participants in the compliance review programs will attest to whether they comply with the federally mandated operating rules, which are the phases 1 through 3 CAQH CORE operating rules. They completed a pilot at the end of last year, so they have a good sense of how the program will run, and per their announcement, they noted that in April they had planned to randomly select 9 HIPAA-covered entities, a mix of health plans and clearinghouses, for compliance reviews. So they will kind of randomly select and go in and audit compliance with these standards, code sets, and identifiers, plus the attestation for operating rules. Providers will be able to participate in a separate pilot on a voluntary basis later this year. Moving forward, they've shared that these compliance reviews will be conducted periodically with randomly selected organizations. Non-compliance, they will first give organizations the opportunity to take corrective actions to achieve compliance, and those that do not achieve compliance may be subject to escalating enforcement actions. We know that penalties for HIPAA non-compliance can be up to $1.5 million. Next slide, please. CMS and ONC also came out with some new proposed rules earlier this year. The comment period for both rules are open now. These rules relate to giving patients access to their health information and advancing interoperability across the healthcare environment. They highlight the use of APIs and some of the newer emerging standards to ensure that this information is accessible to patients. The public comment period is open. It closes on June 3rd, and we encourage everyone to take a look at these MPRMs and share your thoughts with ONC and CMS. With that, I will turn it over to our next speaker to talk a little bit more about our new rules.
Great, thank you. Thank you so much, Erin. My name is Rachel Goldstein. I'm a senior manager here at CAQH CORE and have been working quite a bit on our prior authorization effort. Next slide, please. So today I'll talk through where our energy is right now with prior authorization. The rules that we just released are excited to share with you all. I'll talk about those a little bit, and I'll also share with you some of our upcoming initiatives that are already underway. We have a lot of exciting work going on. The vision here for prior authorization is to move forward as an industry together towards a process that is more optimized by automation. We know there's never going to be a fully humanless process with prior authorization. There's always going to need to be a little bit of a human touch given the nature of it, but the more we can go more towards the green that you see is going to be better for everybody, reduce burden, get patients their care faster. We've been working on prior authorization for some time. We do have 2 sets of operating rules now out, which we'll talk a little bit more about. And then we're also working on specifically on updating a response time requirement to include a requirement for a time frame for final determination, and also looking at piloting some existing and new operating rule requirements to make the electronic discovery of what requires a prior authorization much easier for stakeholders. Next slide, please. Here you'll see a roadmap, high level of kind of where we've been, where we're going with prior authorization. Prior authorization is a complicated topic. There's a lot of wonderful industry organizations working on trying to make this process easier and less burdensome for providers and plans. And in terms of where we fit and where we're going, for the past 4 years or so, we've been pretty focused on developing some foundational infrastructure requirements for prior authorization to make sure that the request and the response can get from A to B with those trading partners in a way that really makes sense and is consistent with the other standard HIPAA transactions. And we've also focused on creating some additional data content requirements for the standard transaction. With the Phase 5 rules that we just came out with, we focused on building on that even further. And it was really a result of a pretty intensive environmental scan that we did that really by the end of it and by the end of our rule development in Phase 5, we had worked with well over 100 stakeholder groups to get to this outcome. And we really looked at what are the burdens, what are the barriers to adopting the standard transaction? How else are people today conducting prior authorization? Where are the pitfalls? Where are aspects in the process dropping to manual human intervention? And what are some potential ways that we could help reduce that? So you'll see that where we're going this year and next and into 2020 is we're looking at some additional requirements and using a use case driven approach, applying some of our existing requirements and new ones that we developed to both existing standards and emerging standards. So we're really looking forward to pilot testing some new requirements. For example, looking at how does a provider know if a PA is even required for a certain service? What's the easiest way to get access to this information electronically? And the questions that often follow from that. And also, like I mentioned, we're updating our phase 4 rule. We're looking at creating an enhancement so that we actually have our first task group call today on this to think about how we can add a final determination time frame for a prior authorization, which was actually one of the key things that came out of our environmental scan, and we're looking forward to picking up more traction on that now. We're also looking to update our connectivity rules to take into account some additional standards. And looking into the future and even starting now, we are looking for ways to more rigorously test out our operating rules, collect ROI, iterate on those rules, and get them out to industry quicker. So we'll be looking to apply some of our existing requirements and new ones to additional use cases that really intersect with PA, such as attachments. Next slide, please. So let's talk a little bit about our phase 5 rules here. Let's dig a little bit deeper. We'll give you a bit of an overview. So like I mentioned, the phase 5 rules that just came out were a result of working with well over 100 stakeholder groups across the industry. The core voting participating organizations approved the rules recently, and so did our core board, and a really high approval rating, nearly 90% there. I do want to just quickly give a big shout out and thank you to all the participating organizations that are on the line right now that I know contributed to these rules and voted on these rules. We absolutely could not have done it without all of you and your input. So as you can see, there's 2 rules that came out of this process. They stemmed from the major pain points in the scan. The first rule is the 278 request and response data content rule. This rule targets one of the most significant problems in the prior authorization process. Those requests for medical services that wind up being pended upon receipt at the health plan due to missing or incomplete information. Usually this is due to the need to provide some additional information that proves medical necessity to get that PA forward through the adjudication process. So the rule requirements within this rule reduce the unnecessary back and forth between the providers and plans so that there can be a shorter adjudication time frame, fewer staff, and less manual follow-up. The second rule we have here is the prior authorization web portal rule. And this is really building a bridge towards overall consistency for requests and responses by providing for more uniform data fields in the web portal transaction mode, ensuring confirmation of the receipt of a request, and having standard system availability, more uniform system availability. CORE really sees this, and our participating organizations and our board see this as an interim strategy to bring greater consistency to web portals given their current widespread use in industry, with the long-term goal of driving adoption of standard transactions. Next slide, please. So here we've outlined the key rule requirements, what's in scope and what's out of scope simply on one slide. So if you only look at 2 slides in this whole deck, if you want to know what's in the phase 5 rules, I would say look at this slide and the same version of the web portal one, which we'll cover in a moment. So here you'll see the key rule requirements. For the first rule is that 278 data content rule, which applies to the standard transaction. The key rule requirements are consistent patient identification and verification to reduce common errors and denials, return of specific error codes and action codes when certain errors are detected on the request, return of other decision codes to provide a clear explanation to the provider, use of codes to provide clear direction on status and what additional documentation is needed for adjudication. I'll do a quick dive into that one on the next slide. And detection and display of codes in some actual language that's going to reduce the burden of interpretation. This rule applies, like I mentioned, to the standard 278 transaction for all PA procedures, lab testing, medical services, devices, supplies, and medications within the medical benefit. It does not apply to medications that are covered by the retail pharmacy benefit. So you'll see that in out of scope. It also does not apply to emergency or urgent requests or referral requests. Next slide, please. So here on this side, you'll see the middle part of the PA process. This is, again, like I mentioned, one of the biggest burdens that we heard time and time again, is when a request is submitted to a health plan, the provider sees that the request has gone through and there's a pend. And generally, most often with complicated requests, they drop to a pend because the health plan needs to figure out what is needed to prove medical necessity. The problem with this is that often the provider isn't sure what the pend is stemming from and hasn't necessarily received the information in an electronic fashion to know what they need to do to move that pend forward through the adjudication process. And so they have to pick up the phone. They have to often, long wait times and really sit there on the phone and wait to talk to somebody. I'm sure many of you on the line are aware of this. And the challenge is that even when a request may have been submitted electronically, this is one of those pitfalls where it drops to manual human intervention because you just really don't know what needs to happen to get to the next point. So one major requirement in the data content phase 5 rule for the standard transaction is that when the PA request is pended for additional documentation, the rule requires the use of specific standard codes in conjunction with detailing the types of documentation required for the prior auth to move forward. So this really helps because the provider can then see, okay, I know why it's pended, and I know what types of additional information I need to send over to that provider. So this definitely aligns with some of our attachments work that my colleague Taha will be talking about a little later. Next slide, please. Here, that's that second slide. I said if you want to know what these rules cover and only 2 slides you pay attention to, this is the second slide to pay attention to. So this is our web portal rule, the second rule that I mentioned as part of an interim approach to getting to more standard transactions. The key rule requirements here are the use of those actually standard transaction names from the 278, the implementation names for the data fields that you actually see on the web portal. This reduces variation and is a huge help for providers that have to be filling out these web forms. It also calls for system availability requirements for a health plan to receive requests to enable predictability. It requires confirmation of receipt to requests to reduce manual follow-up for providers. And actually, when a web portal operator is mapping the collected data that's in that web form from a portal to a 278 standard transaction on the back end, it also says, and by the way, you have to adhere to the 278 data content rule as well. So it pulls in the benefits from that rule to this rule in those scenarios. So what's in scope and out of scope? This rule applies to any web portal used to submit a referral, as well as PAs for procedures, labs, medical services, devices, supplies, and medications within the medical benefit. It's the same as the other rule in that it does not apply to medications covered by the retail pharmacy benefit. It applies when any entity and its agent make available a web portal to a provider to submit a PA request or referral. It also does not require an organization to conduct, use, or process a PA or referral via web portal if it does not currently do so. So now on the next slide, this is a depiction of how the Phase 4 and Phase 5 rules work together to tackle major pain points. So you'll see the white stars are the Phase 4 requirements that are more infrastructure-based. So you'll see connectivity and security methods, that response time requirement in the middle there, companion guide, and the purple stars is what the values that's also been added to work in conjunction with the Phase 4 rules with the new Phase 5 rules. On the next slide, we'll go over what are our next steps. So now that the Phase 5 rules are out, what can you do about it, and what does that mean for you? So first of all, if you want to hear in more detail what these requirements are, how we got to them, what impact we think they're going to have, certainly join us for our webinar on May 29th to hear in more detail. And we're going to have two of our industry co-chairs on the line from Harvard Pilgrim and Montefiore Health System. You can also start considering CORE certification for both Phase 4 and Phase 5. We'll talk about this a little bit more, I think, later in the presentation. And I should note that Phase 5 certification will be available by the end of the year, but Phase 4 is currently available for use. Also, please stay tuned. We're going to be posting some additional implementation support on our website, including some FAQs and analysis and planning guides, so stay tuned for that. And also, I'm now going to cover some of our upcoming work, which is, I shouldn't say upcoming, as we're here, and hoping to get a lot of you involved in that. So I'll go through that now. Next slide, please. Great. So the first item I'm going to cover today, there are really two items I'd like to cover with you in terms of our continued work on prior authorization. The first one, like I mentioned, is that update to our Phase 4 rule to enhance the response time requirement. So I'll go over that. And then I'll talk to you a little bit about our pilot initiative. So here, our Phase 4 task group that's looking at this, made up of CAQH CORE participating organizations, is actually launching today. We're really excited about this work and think it's very important. We're evaluating opportunities to essentially include a response time requirement for a final PA determination. Currently, the Phase 4 rule does have a response time requirement for a response to a prior authorization, but not necessarily for a final determination. So we're going to take a look at updating that, and we've received quite a bit of interest and support from our participating organizations to take a deeper look at that. Next slide, please. Also, the second big project that we have launching is our pilot project. And as you saw earlier in our PA roadmap slides, CORE and our board is very committed to building operating rules that support existing and emerging standards. And the PA Pilots Initiative is really intended to look at the impact of various ways of getting through the PA process electronically, and will help identify what additional operating rules are needed through some workflow gaps. And the impact we find is really going to inform future decisions and operating rules for industry. On the next slide, I'll walk you through what our conceptual model is looking like. So on the left side here, you'll see the provider environment, and on the right side, a payer environment. Obviously, this is a very simplified model, but from a conceptual sense, I think it makes sense. So you'll see that the pilot, what is the environment or the universe in which we're looking to develop some requirements and test out some existing requirements. So the first is that foundational infrastructure that you'll see in component A. And it includes connectivity, security, and other items, acknowledgements. Component B is asking that question, is prior authorization required? And if so, what additional documentation is needed to really get that through? So you'll see there's a variety of different standards here, standard modes that you can use to really ask and answer these questions. And so, you know, our pilots are going to be taking a look at how can we use these different standards, layer our operating rules on top of it, and see if we can really make some more progress here in getting asking and answering these questions in electronic fashion. The third major component is the full prior authorization request and response, and so really it's submitting that request. It can include the additional documentation. Perhaps you've already gone through component B and you know what additional documentation is needed, so it's been solicited. That request for additional documentation is solicited, and you can submit it in parallel to your PA request submission there. Or you can just submit the PA request, and if in fact it is pended due to need for additional documentation, then actually, like I just described, the CORE Phase 5 data content operating rule can provide those next steps and that instruction for you there. So essentially, we've received quite a bit of interest from our participating organizations about this pilot universe of options, and so we're talking to organizations right now about what they're interested in, which components they're most interested in. You don't necessarily need to pilot everything. You're certainly welcome to. But really, we're looking at matching organizations together on the payer and the provider side to essentially be trading partners to test out some of these approaches. Next slide, please. I alluded to two different ways that attachments comes into play here. Actually, there are a multitude of ways that attachments can come in. I should specify that we mapped out two ways that we would suggest attachments come into play here. And both are from the solicited workflow perspective. Actually, I think my colleague Taha will define that for us in a bit, but essentially that means that they're not sending, providers aren't sending everything kind of upfront without knowing what exactly to send, but it's more of in a response to knowing what to send. So here in this approach, the provider has heard back that a PA is required, and they know what additional documentation they need to send. So here, when they actually do send the authorization, you'll see the two purple lines on the bottom. They're sending both the authorization and the additional documentation in parallel. Alternatively, on the next slide, you'll see a scenario where the provider may not necessarily have, well, for example, pilot tested the prior component, may not really know what additional documentation is required for prior authorization to be fully adjudicated. And so essentially, they will submit their prior authorization request. They will, and if prior authorization, if additional documentation is needed, that will be communicated back to them. And then finally, the provider will send that additional documentation over to continue the adjudication process. So that is just a little bit of a sneak peek into our pilot program. And I'm now going to hand it over to Jessica for a polling question.
Thank you, Rachel. That was very comprehensive, very helpful. And as usual, you've made my life easy as we launched our first polling question. We'd like to know what work you would like to engage with us on. So feel free to select all that apply. Are you interested in engaging with us on our Phase 4 response time task group work, our pilot work, or are you interested in being a beta tester for Phase 5 certification? So I think what we'll do is we'll keep this information with us after we've finished with the poll, and we'll reach out to all of you, and thank you in advance for engaging with us. And now, for an update on our work on attachments, I'd like to introduce CAQH CORE Senior Manager, Taha Anjarwala. Taha?
Thank you, Jessica. Before I begin, I just wanted to preface kind of an overview of our attachment work. So given CAQH CORE's mission and vision and our designation as the operating author, one of our key goals is to kind of solve the industry challenge on additional documentation or attachments. And over the past few years, we have collaborated with more than 250 different organizations in providing education, gathering insights on the topic of attachments. And as an example, over the last 2 years, we held webinar series on attachments, providing industry education on technical standards and also implementation experience for that particular transaction. And most recently, we've conducted an environmental scan and released a white paper to highlight the challenges and opportunities to promote adoption of electronic attachment transactions. And I'll be covering the white paper that we just recently published over the next few slides. So on the next slide, so today I want to paint the picture of what the current state of the industry is. The attachment workflow is really primarily a manual process, and it's a large source of significant administrative burden, largely in part because there's no federal standard has been adopted. And looking at findings from the 2017 CAQH Index, it was reported that and estimated that 204 claim attachment transactions were conducted annually between providers and plans, and that only 6% of those were, in fact, using standard electronic transaction methods, and the bulk of those, 84%, were exchanged via manual methods, via mail and fax. So, I'd like to point out that that data is just for claim attachments alone, and there are several use cases that attachments are used for, such as prior authorizations, value-based payments, appeals, audits. So as you can imagine, there's a large volume and big industry burden with exchanging and processing medical information once you add all those use cases up. And we need more data to really fully articulate and scope what the attachment challenges today. So we're in the process of engaging in the 2019 CAQH Index study. So if you're interested in providing data for this effort, please feel free to contact CORE. So on the next slide, I'd like to dive in on and level set on some of our work on our environmental scan on attachments. So over the course of 2018, we conducted an environmental scan to really truly understand how the industry currently exchanges clinical and administrative information. We had more than 40 organizations participate with us and contribute insights on this environmental scan. And this included a diverse group of health plans, vendors, providers across different markets, including medical, dental, and workers' compensation. And our environmental scan really studied industry challenges associated with managing attachments across various use cases that I touched on earlier. And really, we tried to identify opportunities to reduce burdens associated with attachment, and really through education and looking at considerations for potential operating rules in the future. And one of the key insights and takeaways from the scan is, we tried to really understand what some of the primary reasons the industry has delayed adoption of electronic attachments. And we polled attendees on a recent webinar to really identify those causes. And not surprisingly, a majority of individuals indicated they were waiting for federal and regulatory direction, about 44%, for the government to really mandate and adopt an attachment standard. However, nearly 25 or a quarter of organizations communicated that they were waiting for some industry direction, meaning that there's room for the industry to come together to convene and coalesce on a standard to use. So there's some interesting data there that really guides some of our work efforts moving forward. So on the next slide, a culmination of our environmental scan, we conducted the scan through interviews of the various stakeholders I mentioned. We did phone interviews, we did on-site visits and surveys to really gather as much data as possible to really truly understand where the pain points of the industry are. And as a result of that work, we published a white paper about 2 weeks ago to report our findings to the industry. And our white paper really examines the challenges associated with the low adoption of attachment transactions and identifies 5 different areas that really we think can help support and accelerate the industry adoption of electronic attachment transactions by creating a more uniform approach. The white paper is available on a website and also accessible via the links on the slide. So on the next slide, I'd like to dive a little bit deeper and really provide you all with a very brief overview of some of our findings. So we identified about 5 different opportunity areas in our white paper. They include workflows, data variability, exchange mechanisms, infrastructure, and resources. And I'll briefly provide an overview of each. So the first area is workflows, and these really map out the different steps and processes needed to accomplish complex tasks. So in the context of attachments, there are 2 primary workflows that we saw. And Rachel kind of mentioned earlier, was solicited and unsolicited. The solicited workflow is really a multi-step process and is designed to ensure inbound documentation is a better match with the health plan's needs in order to adjudicate a transaction such as a claim or a prior authorization. And the challenge really identified with the workflow issue is that in the solicitor process, this really doesn't occur in real time, which often results in a pended response or, which is awaiting review by the health plan. And this time frame really can cause patient care delays or impact the revenue cycle. The second type of workflow is the unsolicited workflow, and this is where a provider submits an attachment concurrently with the associated transaction. And the challenge with this particular workflow is on the health plan side that they identified is that a lot of times and oftentimes providers submit too much, too little, or the wrong type of information, which cause burden for them to delay and process the transaction. So within the workflow category, we identified a few opportunities to really reduce the workflow burden, which include identification of clear documentation requirements and possibly developing timeframe operating rules for the return of information. And looking at the second category, which is data variability, and this really means the degree to which data is shared between parties and diverges from expected structures. And there are 2 really significant challenges we identified. One is the reassociation of attachments to an administrative transaction, which is really the inability to link documentation with a companion administrative transaction request. And oftentimes the challenge with this is that this leads to transactions not being able to be linked together or may lead to pending requests or delays in adjudication. And the second challenge related to data variability is the use of unstructured file types, which have were reported to create issues with quality, readability, and the ability to really automate adjudication processes. And looking at opportunities and recommendations to improve and reduce the data variability is that the use of more structured file types, such as CDAs, and more uniform data sets to make it easier for health plans to keep attachments linked together and enable automated adjudication processes. Looking at the third area, which is exchange mechanisms, this really refers to how information is transferred from provider to health plan. And looking at challenges with this is that a lot of times the exchange mechanisms today are primarily mail and fax. So how do we really promote adoption of more electronic exchange methods? Because there's definitely a lot of multitude of options between mail, fax, lots of proprietary solutions out there. So how do we streamline and reduce that burden? So some of the opportunities and recommendations to address this area include promotion of greater adoption of electronic methods, such as the use of the X12275 transaction or use of HL7 Fire to really streamline and reduce the number of ways attachments are exchanged. Looking at the fourth area, which is infrastructure, these really are the fundamental instructions that every data exchange system needs to work in regards to connectivity of machines, security protocols, and just basic communication expectations. So some of the challenges we identified in our white paper related to infrastructure include the lack of clinical and administrative system integration, such as between the ability for electronic health record to pass information into a practice management system. The second area is the inability for systems to acknowledge when information is received. And the third is the variability around timeframes for when attachment transactions need to be adjudicated. So looking at opportunities and recommendations how to improve infrastructure, one of our key recommendations is really looking at convening and coalescing on uniform communication standards to really make it easier for systems to connect, secure, and share data. And lastly, moving into the fifth opportunity area, utilities, which are really a single source of truth sort of resources that are used by the industry and are trusted party and capable of facilitating and collaborating to drive consensus among parties. So what I mean by this is an example of this would be like a companion guide between a standard companion guide to really showcase where data is. And one of the challenges with the lack of resources is a lot of times there's non-uniformity and lack of transparency with when attachment data is needed. So looking at those documentation requirements with health plan attachment policies and the frequency that when those policies are changed. So really the key recommendation out of this area is really to develop opportunities to create standard companion guides so that requirements and requirements for when attachments are needed are available and are structured with a uniform flow and format across all health plans. So I know that was a lot of information, but I just wanted to briefly really try to nail down some of the key findings of our attachments environment, or of our white paper. So moving into next steps for CORE. So we want to really continue building upon these findings for the white paper. We definitely want to engage with you all as an industry. And one of the key things that we'll be working on is launching an attachments advisory group later this summer to really drill down on some of the challenges and opportunities that I highlighted on the last slide to really determine what potential options for operating rules could be. So if you're interested in engaging with us, feel free to contact the CORE. Further, we'll be holding a webinar in July to really dive, which will provide a lot more detailed and in-depth insights from our white paper. So if you're interested in learning more, feel free to register for that webinar. And we are also continually monitoring the status of federal activity around attachments at PRM. So we'll keep you all as an industry updated as we get more information. So with that, I will turn it to Jessica for our next polling question.
Thank you, Taha, for your presentation. And yes, please join us in July if you want to hear more about the attachments work and the attachments paper that we just released. In the meantime, if you're interested in getting involved, feel free to respond to this polling question and let us know if you want to work with us, if you're not sure, need more information. We'll just pause for a few seconds and collect your information, and then we will go ahead and follow up with you afterwards. So let's go ahead and close this poll. And next, we will get an update on our work on value-based payments. Our next speaker is CAQH CORE Manager, Lena Geber-Mariam. Lena?
Thanks, Jessica. So today I just wanted to give you all a brief update on what CAQH CORE is doing in our ongoing value-based payments initiative. So go to the next slide. As a reminder, CORE launched a report in 2018, which analyzed the operational challenges that may slow or add cost to the implementation of value-based payments. And what this report really found was that unless the industry takes timely and collaborative action to prevent value-based payments from confronting the same administrative roadblocks that fee-for-service encountered, we're doomed to repeat our mistakes. So earlier this year, CAQH CORE launched the VBP Advisory Group, whose goal is to execute this vision of a common infrastructure that drives adoption of the VBP model by reducing administrative burden and improving the exchange of information. This group has been working for the past 4 months, made up of industry executives and thought leaders, to take a look at the pain points in the VBP revenue cycle workflow and really look at opportunity areas to reduce that administrative burden. So if we go to the next slide, you'll see the 12 organizations that make up our advisory group. So I'd like to take a moment to thank each and every one of these folks for the amazing work that they've been doing for the past 4 months. And you'll continue to see great things from them in the months to come. Moving up to the next slide, I wanted to give sort of a sampling of what we have found to be pain points in this workflow, as well as some opportunities that the advisory group is exploring as potential solutions. So when we think about even before a patient visit occurs, when the patient encounter is scheduled, in a value-based arrangement, providers are responsible for the health of a certain population. But if the provider does not know that a patient that is being scheduled to have a visit with them is part of their population or not, it causes confusion on provider end as to what metrics does this population need reporting on, what clinical guidelines am I supposed to be following for this specific plan. So an opportunity area that we thought of here is the ability to return patient attribution information when that provider submits the eligibility check. And this goes throughout the workflow. There's opportunity areas around simplifying the claims process, simplifying the exchange of additional documentation. As Taha spoke, BUP is a large use case for this, as there's often additional documentation related to care gaps, quality measures, or performance metrics, and to clarifying contract performance at the time of claims collection. So if we go on to the next slide, you'll see that our advisory group is wrapping up their work this month. And what they will do is finalize a list of 3 to 5 opportunity areas for further core rule development action. And then CAQH CORE staff will take those 3 to 5 opportunity areas and expand them and do additional research in order to launch a rule writing group and or pilot this fall. So please be on the lookout for more information as we gear up to launching those groups this fall. And if you would like to participate, please reach out to CAQH CORE staff. And with that, I will take it back to Taha.
All right, thanks, Lena. So I'd like to kind of provide everyone just a brief update on our core certification program. So before I kind of provide some key program updates, I just want to, on the next slide, define our certification as a whole. So core certification offers cost savings, industry recognition, and market advantage for organizations that exchange administrative healthcare information. The certification program is really designed to streamline and ensure the streamlined exchange of administrative transactions by aligning IT systems with federally recognized and industry-developed operating rules. And the program is really industry gold standard. So really, what makes the core certification program gold standard? So I think there are 3 important elements for us to consider. First is the fact that the program was developed by industry for industry via transparent discussion, review, and voting process. This is the same industry-driven process that develops the core operating rules and that Rachel had mentioned earlier. Second is that certification requires PDI-based testing, really to ensure that organizations have implemented operating rules and standards correctly. You know, this really goes beyond other programs that only conduct documentation and policy-based reviews. Third is that CAQH CORE, we serve as a neutral administrator to ensure that an organization really has gone through a thorough testing and vetting process before a core seal is awarded. This really ensures the integrity and value of the core seal. So with that, I just wanted to provide a brief overview of the certification program as a whole. If you want to move into the next slide. So not only does certification really track adherence to operating rules and standards, but we also track market adoption of the rules and standards as well. And to date, we've awarded 361 certifications across phases 1 through 4. And I'd like to take some time to give a shout out to our recently core certified organizations. Eligible, Health Trio, Frontrunner, and Security Health Plan. Congratulations on your accomplishments. And you know, the pie chart on the right-hand side really illustrates the penetration that those seals have on various market segments of the healthcare industry. On the next slide, I'd like to provide 3 key updates that are happening to the certification program for 2008 for this year and next year. So recently, we are now offering bundled certifications, and what this means is if you're an organization that is pursuing more than one phase of certification at a time, we are offering 20% discount on that initial certification fee. So if you're doing multiple certifications, you're eligible for a discount, really to promote adoption of operating rules and the standards. Our second key program update is that we are looking at seeking to launch a recertification program in 2020. And really the reason in the shift to move to that is that currently, certification is really a snapshot in time towards adherence to operating rules and standards, and we recognize that as technology evolves at a rapid pace, there's a need to assess ongoing conformance, and as we make updates to operating rules and as transactions also get updated, there's a need to have systems recertify conformance to those rules. So we'll be launching a certification program in 2020 with recertification happening every 3 years after an organization gets certified. And as operating rules get updated, those will then now be incorporated within the recertification process. So stay tuned as throughout the year as we gear up towards that launch for more information. And lastly, the last update to the certification program is particularly around Phase 4 certification. So as you may know, the Phase 4 rules cover 4 transactions: the 837, which is the claims transaction, the 278, which is the prior authorization, and the 820 and the 834 transactions, which are more so employer-based transactions. So we made some changes to the Phase 4 certification process that now requires stakeholders to test for the 837 and 278 transaction if they apply to you, and testing for the employer-based transactions are now optional. So if you're a health plan that implements all those transactions, you're required to do the claims and prior authorization, but you have the option to choose to test for those employer-based transactions. So that's a new update to the certification program, just to ease the burden and really to drive more provider to payer on the revenue cycle. So on the next slide, I'll have to talk about, so as Aaron mentioned earlier on in the presentation that CMS is now live with a compliance review program. I'd like to kind of talk about how certification may help you prepare for those reviews. So certification testing is really, and the issuance of the core seals really helps organizations give assurance that they have complied with federally mandated operating rules and standards, and they, and give the feeling of more confidence in the event of audit. It's kind of like using TurboTax, going to a third-party accountant to help you submit your taxes. It's really good practice to find somebody outside of your organization to check your work, make sure you did it right, and core certification is that kind of check for the operating rules and standards. And certification is really a tool that helps you prepare for those potential compliance reviews, audits, via our comprehensive and testing and application process that I mentioned earlier. And certification is really positioned to help organizations assess, demonstrate, document, and certify conformance with those federal standards and operating rules, which hopefully will instill confidence in the event of an audit. So with that, I think those are the key program updates for certification, and I'd like to pass it over to Jessica for our last polling question.
Thank you, Taha. So let's go ahead and kick off our next poll. And this is if you want to learn more about core certification, you need more information, please fill out this polling question and we'll go ahead and follow up with you afterwards. We've had some exciting changes and updates to the program and more to come, so we are happy to share that information with you. So let's, I think we can go ahead and close this poll, and then we'll move on over to our Q&A section. If you have questions, please go ahead and submit them. In the meantime, we have received a couple of certification questions, and I'm not sure, I'm going to send these to Taha and to Bob. So the first question is it possible to combine Phase 4 and Phase 5 certification once Phase 5 is available?
Yep, definitely. So once Phase 5 certification is available towards the end of the year, you will actually be able to test the 278, that prior authorization transaction at the same time. But in the meantime, if you're considering certification for Phase 4, you can go ahead and contact us, and we'd be glad to get you started on the process. And that way, whether or not you do need to do system remediations, gap analysis, we can help you prepare if you're considering that route. So you can definitely do both together once Phase 5 is launched, but you can help prepare now if you're ready.
Great. And then one other question about certification is approximately when will Phase 5 certification be available?
Sure. So we are targeting towards the end of 2019, so sometime late Q4 is our target. But we'll definitely provide you all with updates as we move into later in the year.
Okay, great. Well, with that, let's move on to the next slide. We've been alluding to a lot of upcoming webinars and conferences. So here's a list, and including some hyperlinks so you can go ahead and register. And for those of you that are attending WEDI next week, we look forward to seeing you there. Please come to the presentation that Taha and Rachel will be giving on attachments and prior authorization. And then let's move on to our next and final slide. If you do have any questions, I know that we've just given you a lot of information about all of our initiatives, but if you want to learn more or you have any questions, that's a way to reach us via our website or email. Thank you so much for joining us. Good afternoon.